A very good morning to all of you, and welcome from Team Aakriti. This is, as Dr. Agnes talked about Aakriti, and you'll hear about Aakriti as we go on and on today. Thank you so much for gathering in good numbers early morning on a Sunday. So we start with our first topic, and that is on platelet-rich plasma. So as gynecologists, we know that PRP is now entering into, so I think majorly it is into orthopedics, dentistry, hair, but it's gathering momentum in gynecology also. So we have two sessions today. Right now, of course, just preparation. We'll be talking how to prepare PRP, what are the methodology. And in the next session, we'll be talking of ovarian endometrial regeneration through PRP, stem cells, and the other modalities. Okay, so platelet-rich plasma, as we said, is a non-operative way of regenerating, and we talked of urology and dermatology and other branches. So what is it? It is autologous. So you don't require, why FDA has given approval? Because it's your own body. It's not as if you're taking anything from outside. Concentrating the platelets in a small plasma, that is, and increasing the number 5 to 10 times. And since it is platelets has got a lot of growth factors, so you will see how we prepare it. Platelets have got two kinds of granules, and alpha granules and dense granules. And they are formed in the bone marrow, as like all others. It's 2 micrometer in diameter, and it has 30 bioactive proteins, of which 7 secrete growth factors, 5 initiate wound healing, and 3 proteins, this is also important, which helps in cell adhesion: fibrin, fibronectin, and vitronectin. Now, why we are talking of, as soon as there's a wound, what happens? First thing that happens, and we've learned this through all our medical careers, that platelets are the first, molecule which comes to aid wound healing. And growth factors in the platelets are, and this is important because, you will also understand if you have vascular endothelial growth factors, so it's what is helping angiogenesis, platelet-derived growth factors, insulin-like growth factors, transforming growth factor beta, fibroblast growth factors, connective tissue growth factors, interleukin-8. So all these are extremely important growth factors which are there in the platelets. And the moment they degranulate, the moment we are able to degranulate, it's an honor and a privilege to have Dr. Jain ma'am. And since she has been so active in this whole field of regenerative medicine, it's an honor, ma'am. Thank you, ma'am. All these growth factors are very important for healing and formation of new vessels, collagen production, and regeneration. So if I look at, each factor separately, platelet-derived growth factor, it's mitogenic. So what you are doing is you are creating more cells. Mitogenic for mesenchymal cells, osteoblasts, chemotaxis, mitogenesis, collagen production, and stimulating undifferentiated cells to become differentiated, endothelial, fibroblasts. So I'm not going to go into each of the factors, but you can see that all of them are causing angiogenesis, then they are causing collagen production, they are causing mitogenesis, so they are stimulating growth, where they are used especially in fractures and healing of wounds. So they have seen that the moment they inject PRP, healing is so much faster. So what are the properties of platelet-rich plasma? Whenever they are activated, they cause degranulation and secretory proteins, all gather there. It causes the expression of gene sequence, which causes matrix formation, osteoid, collagen synthesis, tissue repair, and tissue regeneration. Active secretion begins within 10 minutes of activation. So the moment you make PRP, it is important to understand that within 10 minutes of activation, active secretion of growth factor starts. And 95% of this is secreted within an hour. So what is the count that you have to see? A platelet count they have seen of 10 lakh per ml in 5 ml of PRP is a working definition based on scientific proof. So what they have seen after doing a lot of studies, how much number of platelets is good enough. So they've seen that 10 lakh per ml in 5 ml of PRP is a good count. Of course, what causes activation and, is this the count that we are looking at? Suppose it is not 10 lakh. So studies are still going on, and we can activate the PRP by calcium, thrombin, and adding collagen. So this was a multidisciplinary consensus conference in 2012, and they have divided PRP into 4 types of pure platelet-rich plasma. Then there is leukocyte, platelet-rich plasma, and most commercial preparations fall under this. Then you have pure platelet-rich fibrin, which is a strongly activated gel form. It cannot be injected. It is leukocyte poor. That's why you call it pure platelet-rich. And the one which is with leukocyte, you call it leukocyte and platelet-rich fibrin, which is a second generation PRP with leukocyte and high-density fibrin network. So normally you will see that if you take 30 ml, you prepare around 3 ml of PRP. And it of course depends on how good is going to be your PRP. It will depend on your baseline platelet count. So the moment you take blood, you should do a baseline platelet count and see what the count right now. It will depend on the device that you are using. So I'll show you 2 or 3 different methods of preparing PRP. The technique that you are employing, the temperature of the centrifuge. So normally they say it should be prepared in 21 to 24 degrees centigrade. It will all depend on, suppose it's high temperature, then it's a different kind of count that you will get. Time that you are going to do a hard spin, a soft spin, and speed of the centrifuge. So all this is going to alter how, what is going to be your result of PRP depending on the concentration that you will get. So there are 2 methods of preparation, a PRP method and a Buffy coat method. Now, if you look at a blood, you will see it looks something like this. In the bottom, when we centrifuge, you will have RBC, then you have a WBC and platelet, thin line of WBC and platelet, and the rest is all plasma. So you collect whole blood, you do a first spin, separate the plasma and RBC, and then I will show in a video, but this is just to say that you take out the plasma, separate the RBC, again centrifuge second spin, and after discarding the upper portion, the lower portion, which is a pellet, you mix, and this is your homogeneous PRP that you are working with. So first centrifugation and second centrifugation, there are 2 centrifugations that you will do, and this is always collected in a acid citrate dextrose. It's not in EDTA but in ACD tubes that you will collect the blood. Do not centrifuge. We will talk of the spins and how we will do, but it is only to understand that you are separating the RBC and the WBC and platelets. Another is the Buffy coat method, in which the whole blood is stored at 20 to 24 degrees centigrade before centrifugation. You do it at high speed first. 3 layers are formed. The bottom layer has RBC, middle has platelets, WBC, and the top is a poor platelet plasma layer. So remove the supernatant and transfer the Buffy coat into another sterile tube and centrifuge at low speed to separate WBC and this. So now let's look at how it is done. So if you see here, collect around 30 ml in 4 tubes. This is what they have done in vacuum tubes containing acid citrate dextrose. They have separated the upper plasma. They've given a second spin, and the small pellet at the bottom that you can see is the platelet pellets, which are then homogenized in a little bit of plasma to make the enough for it to be transferred. Now, if I look at the various platelets, the protocols that have been used, and these have been the studies, and you will see that what is the platelet count rise that they have seen, and what is the force that they have. So normally they have applied a soft spin first, say 3000 first, and then a hard spin, and this is the kind of rise that is there. What are the contraindications? Any infection, viral hepatitis B, C, systemic diseases, allergic reactions, immunosuppressed conditions, blood clotting disorders, pregnancy, lactation, all these disorders, and age under 18, you are not allowed to give PRP. Dr. Nandini is here also, and she'll also be talking about the medico-legal aspects of preparing PRP and how you can inject and what else to do. So, I think I'll first show the video and then come back to this.
As you can
so
see,
this is a kit by Advanced Cell, and Advanced Cell is here.
The advantage of this is that
this is a special
the Buffy
kit
coat.
that you see here.
So we need some prerequisites before we start the PRP. This is the
gel tube that we require for PRP, which has ACD and gel. We need a 10 ml syringe to draw the blood. This is the butterfly needle that we need. 2 plain tubes. When we are taking the sample using the butterfly needle, the chances of RBCs breaking down is very less. And when you take sample directly from the syringe, there is a high chance that RBCs can break down. So we are going to draw 10 ml of blood from the patient, and as you can see that we are taking it with the help of the butterfly needle. So now we are going to take this PRP tube and put the sample that we've collected in it. This PRP tube has gel and ACD. ACD is an anticoagulant. I'm going to put the sample in it. It is going to prevent clotting, and gel has its own benefit, which we are going to show you in the later part of the video when we are going to centrifuge this sample. After we've put the sample in the tube, we are going to mix it gently like this. We are going to make sure that ACD is mixing properly with the blood so that it does not clot later. Now we are going to centrifuge this sample. As you can see, this is our centrifuge machine, and we are going to take 2 test tubes because we have to put 1 extra test tube so that we can create a balance. And we put water in this test tube. This goes on one side and the centrifuge sample goes on one side. So we are going to centrifuge this sample for 10 minutes. As you can see, we have set the timer to 10 and at 3000 rpm. So now centrifuge has been done for 10 minutes. So what you can see in the lowermost end is the RBCs that are collected. The middle part has the gel, and above the gel is the PRP. When we centrifuge this sample, the gel automatically comes from the bottom to the middle and separates both these samples, which we basically are aiming at. Now we're going to collect the PRP sample in another test tube. So this has all the growth factors and platelets and everything that we are aiming to get out of this sample. So now we are going to put this sample again for centrifuge, and as you can see, we have discarded some of the water from the previous test tube because the sample size in both the test tubes, the one that we want to centrifuge and the one that we are putting in for the balance, it should be somewhat same. Now we're going to put both the test tubes in the centrifuge machine. This time we are going to centrifuge the sample for 5 minutes at 1200 rpm. As you can see that the plasma has separated and there is a small buffy coat on the lower end of the tube. So this buffy coat contains the maximum growth factors and platelets, which is the best sample. Okay, and we are going to take out the upper 2 ml and keep it on the side if at all we want to use it later on. So we are now going to separate the sample, and we're going to retain the buffy coat along with 2 ml of the plasma, and now we are going to mix the sample like this. So we are mixing the plasma with the buffy coat so that the platelets, they get activated. When you're doing this, you are activating the platelets, and also you're making sure that the entire sample has good amount of platelets and growth factors and all these things, so that when we are injecting it on the different sites, we are making sure to get the result everywhere. So now we're going to take 1 ml BD syringe and load our sample in it. As you can see, we've loaded the sample and it is ready for use now. Now this is the third method of preparing PRP. The simplest one, if you don't have the PRP gel tube or you don't have the advanced kit, this is how you can do. The things that we require for this are the ACD, the anticoagulant of course, 120 ml syringe, a 5 ml syringe, butterfly needle, 2 conical flasks which are of 15 ml and 2 pipettes. Always label your tubes because you don't want the samples to mix up. Now the blood that we have taken, we are going to put it in these tubes. Now we are mixing the sample with the anticoagulant gently like this. Now we are putting it in the conical test tube. In one tube we have the sample that we want to prepare for PRP, and in the other tube we have water. Now we are going to centrifuge this sample for 10 minutes at 3000 rpm. Now the sample has been centrifuged, the plasma has separated and the RBCs have settled below. There's a clear demarcation. So now with the help of the pipette, we are going to separate the plasma from the RBC sample. We are going to take it in another tube which we've already labeled. This plasma that we've separated, we will be centrifuging this sample again. So we have removed some of the water from the balancing tube as well. We have to make sure that the sample is same in both. This time we are going to centrifuge this sample for 5 minutes at 1200 rpm. This is the sample after the second centrifugation, and this is the plasma. And as you can see here, we have the buffy coat which is settled down at the bottom of the tube after second centrifugation. This buffy coat is containing the maximum number of platelets. It has a platelet concentration, and now what we are going to do is we will take out around 2 to 3 ml of the plasma from the above, which we call the supernatant. We are not going to discard it as such, as if maybe later if we need to require to use this sample, we'll use it. And with the remaining plasma that is left in the other tube with the buffy coat, we will mix it nicely and use it for the ovarian PRP that we've planned for this patient. Now we are going to mix the sample like this with the help of the pipette. And now our sample is ready to be used. We are going to take it in a 5 ml syringe and then use it for the ovarian PRP. So these are the things that are available in the advanced kit. This is the advanced concentrator. As you can see that it has a neck area, and the advantage of this is that the buffy coat is going to collect in this neck area. We have a 20 ml syringe, a 5 ml syringe, and 5 ml of ACD, which is the anticoagulant, a butterfly needle, one spinal needle, and a 17 gauge needle extra. So now we are going to draw 2.5 ml of ACD into the 20 ml vial. Now we are going to take the 20 ml blood sample that we have, and we will put it in the advanced concentrator. As you can see that it has 2 openings. There are 2 openings on this concentrator. With one, we are going to use it to insert the sample, and the other one we are going to use to draw the sample. Just push in the sample very slowly like this. Now this is the sample in the advanced concentrator. We are going to centrifuge the sample now. So this is the balancing tube. It has water inside it, and you have to just make sure that when you're centrifuging the sample, the quantity of blood and water is same in both the vials. This is our sample vial, and this is the balance vial which has water. Now we are going to centrifuge this sample for 10 minutes at 3000 rpm. Now the sample has been centrifuged, and we will show you. You can see that this yellow part is above, that is the plasma. These are the RBCs, and the buffy coat is in the neck area over here. This is the rotator. Suppose if your buffy coat is below the neck area or above the neck area, you can use this. You can rotate this on the vial, and like this, it is going to be fixed here, and then you can just rotate and shift the buffy coat to the neck area. Now you can see we are shifting the sample to the neck area. Now you can clearly demarcate the sample. This is the buffy coat in the neck area, and this is the plasma, and this is the RBCs. Now using the 5 ml syringe and the spinal needle that is provided to us in this kit, we are going to collect this sample directly from the neck of this tube. As you can see that using this needle, we are going to the neck area of the tube, and directly we are going to collect the sample from here now. So we have collected 2.5 ml of the sample and we are going to use this for the ovarian PRP. As you can see,
the rest of the procedure is all same. So again, you'll have a pellet at the bottom, and then you just the 2 or 3 ml of plasma close to the pellet is what you will homogenize, and this is what you will use. So this is what is platelet-rich plasma. So I think these are all 3 methods of preparation. There are so many commercial kits available in the market which you can prepare. But basic aim was to concentrate 5 to 10 times the number of platelets and which aid in healing. Thank you so much for a patient.